keeping an eye on imaging. Discussion and commentary based on articles from JACC, Cardiovascular Imaging.
Hello, my name is Dr. Vaskan Dilsizian. I'm Associate Editor of JACC Imaging. With me in the studio is Dr. Albert Sinoussis, who's Professor of Medicine and Radiology at Yale University at New Haven, Connecticut. Al, welcome.
Thank you.
Dr. Sinoussis, you have a paper in the current issue of JACC Imaging where you compare a new A2A receptor agonist called regadenoson that was recently approved for clinical use by the FDA to conventional use of adenosine as an IV infusion in canine models. And you compared the hyperemic response in two conventionally used radiotracers, thallium and technetium sestamibi. Perhaps you can tell us something about the experiment and some of your results, what you found.
So the experiment had two phases. There was a chronic phase and an acute phase. In the chronic phase, we looked at normal animals, initially performed adenosine stress with a thallium as a tracer and looked at the uptake and clearance kinetics and then imaging, followed by a short delay. Then we repeated the stress, this time with sestamibi. Then the animals were brought back a week later and repeated the same study, but this time using regadenoson stress, evaluating again the effect of regadenoson stress on uptake and clearance kinetics and imaging.
Okay, you've done similar work in the past in animal models. What was your premise? When you started, what was your hypothesis and what did you actually find?
So we were concerned that with regadenoson potentially having different effects on the peripheral circulation, that the clearance, biodistribution clearance may be different than with adenosine. And we wanted to make sure and use this experiment to optimize the timing and understand the uptake and clearance kinetics of both tracers under this stress. And following that chronic study, then we performed an acute study in the presence of a critical stenosis, where we again compared during regadenoson stress the uptake of thallium, sestamibi versus radiolabeled microspheres, the gold standard for looking at blood flow.
Okay, so let's then first compare the two vasodilators with microsphere hyperemia. Were they comparable?
Yes, in the chronic studies, the effects on hemodynamics, heart rate, and blood pressure were comparable. So a bolus administration of regadenoson gave a similar hemodynamic effect to a 4.5-minute infusion of adenosine.
So you feel comfortable that in the clinical setting, as it was approved, it can be used interchangeably?
Yes.
Now, what about the radiotracers? If you could compare thallium with sestamibi and in comparison to microspheres?
So one interesting thing we found was with regard to, first, the blood clearance kinetics. We found that actually with either stressor, that thallium had a slower blood clearance than sestamibi. And generally we think of sestamibi with a lower extraction, clearing slower and having to sustain hyperemia for a longer period of time. And so that was an interesting observation. But more interestingly, when we compared the uptake pattern of thallium and sestamibi during regadenoson stress, we found that both tracers tended to underestimate relative perfusion versus microspheres. But the distribution of thallium seemed to track flow better than sestamibi during a vasodilator stress.
And I also noticed that when you inject the thallium or image the thallium, there was a 15-minute delay in imaging. And in the clinical setting, as you know, we usually inject and rapidly put the patient under the camera. Do you think that the 15-minute delay might have underestimated the defect size compared to microspheres?
Yeah, so typically clinically we would try to image somebody within 8 to 10 minutes after injection. In this case, we delayed for 15 minutes in part to evaluate the uptake and clearance and biodistribution of the tracer. And there may have been a small component of redistribution of thallium, which would have tended to make the thallium defects smaller, which would highlight the fact that there may be even a greater difference in the linearity of thallium versus sestamibi during regadenoson stress or any perhaps vasodilator
So would
stress.
you like to have clinical implications of this? Would you be concerned using pharmacologic vasodilator with technetium versus thallium radiotracers?
Yeah, based on these observations, as well as observations of others and other experimental studies that we've done, we find that during a vasodilator stress that in fact thallium tracks flow better than any of the tech-labeled agents. And so if the patient is not heavy, thallium may be a preferred agent to use in combination with vasodilator stress.
Yeah.
But as you know,
Yes.
the tech-labeled agents offer other advantages.
This is fascinating, Dr. Stanousas. It's always a pleasure to have you here. And hopefully we'll have follow-up clinical results using thallium versus technetium perfusion agents in clinical setting with the vasodilators and see if truly there are differences in defect size. Thank you again.
Thank you.